Hey guys, so today's topic is Rotterdam's criteria. This criteria we use for the PCOS, polycystic ovarian syndrome or polycystic ovarian disease. So this disease is very common in women who are in their childbearing age, and this is mainly the hormonal problem. Due to these hormones, these women may not ovulate, they may have the high levels of androgens or many other problems and many other symptoms as well. That's why we have this criteria to diagnose the PCOS. So the name of this criteria is Rotterdam's criteria. It includes three things mainly: hyperandrogenism, menstrual irregularities, and polycystic ovaries on the ultrasound. So hyperandrogenism means we have high levels of androgens in the body, and these can be, for example, two types. Let's say clinical, or it could be diagnosed by the biochemical way. So clinical means these women may have some symptoms due to these high levels of androgens. These symptoms could be acne, the male pattern hair loss, hirsutism or skin darkening, and many others as well. But we can diagnose it clinically, and to confirm that diagnosis, and or maybe to add upon, we can just do the biochemical we can go for the biochemical way as well. So biochemical way, that's mainly the hormonal panel. Due to that we can know that how what's the amount of testosterone in the body, and so to and after that we will sum up both of them, and we will diagnose that this is the high levels of androgens. So next thing, we have menstrual irregularities. In the menstrual irregularities, the cycles are generally in these women are more than 35 days. Okay, and if the cycles are taking more than 35 days, and the time is between two cycles, in that case, or we can diagnose or we can count for the whole year, it should be less than 9 cycles in a year. If it happens, that we can diagnose that this is irregularity of the menses. The last thing we have is polycystic ovaries on the ultrasound. So the ultrasound is the gold standard diagnostic test for the PCOS. So how we'll diagnose it, what we'll see in the ultrasound, we should see the more than 12 antral follicles in one ovary, in one ovary, and this ovarian volume should be, this whole volume of this ovary should be more than 10 centimeter cube centimeter. And if, let's say, out of all these three, if two are positive, 2 out of 3 are positive, then this criteria is positive, and then we can say this is the diagnosis of PCOS.